With this outbreak, the outbreak is one serious component. The other serious component is the fear, the anxiety, all of that comes with it. So what I can share right now is that the student is on quarantine out of an abundance of caution. We're following all the guidelines from the CDC and the Department of Health. Despite what you might hear on the news, it's not as easy to get tested, and there's a lot of criteria you have to jump through. So as of now, the student has not been tested, but the student is still asymptomatic. That means that they feel fine. They don't have any symptoms. They're just being quarantined out of an abundance of caution, and we want to make sure that we're respecting their privacy until there's a time that we need to share more information with the campus community. The key thing that we keep getting asked is, can you share where this person has been? Can you share where this person has been in contact with? And what we would say is, if there was a specific cause for concern to an individual or group of individuals, we would let them know. So in this case, no news is generally good news. Day by day, minute by minute, everything keeps changing, and so we have to keep changing and evolving. There's a lot of components to making sure that our students and community members, faculty, staff are well taken care of, that they're safe, that they're healthy, but then also making sure that our operations continue, that students who don't have housing can be housed, that students who need food can have resources and access to that. So we've been looking at that from all different angles and all the permutations and all the obstacles that could put in our way from the non-academic side. And then from the academic side,
we've been following the evolution of the coronavirus and its spread across the world. And over the last 3 weeks, we've been preparing the faculty, at least mentally, to transition their courses from a in-face presentation to a remote type platform, online platform. So over the last 2 weeks, we've taken a very strong position on moving the courses from in-face to online, and the faculty have responded in a wonderful way. They are preparing, they are prepared, and we believe when the curriculum launches to a online platform March 23rd, we do believe that the students will receive the quality of education that they'd expect at Daemen College. We're confident in the faculty and we're confident in the students.
And I think the thing to bear in mind too is that Dr. Brogan and I work very closely with faculty and staff. We work under Dr. Gary Olson's leadership and vision, who's regularly meeting with us, and regularly meeting with senior staff and our emergency response team to make sure that we're pulling this together. There's a lot to this, right? There's a lot of moving pieces, and it's changing on a day-to-day basis. And we're trying to make sure that we're doing all the right things in accordance with requirements from the state and requirements from accreditors and requirements from county executives and state executives, and it's a lot. And so as we've tried to do that, communication has been the heart and soul of everything we've done. We've sent out a lot of communications from both Dr. Brogan and myself and President Olson to just make sure that people have as much information as we can as we have it.
Well, I can say that graduation is still scheduled as it had been scheduled. However, we all know that this whole circumstance is extremely fluid and things change really minute by minute. But presently, the college is still planning on having graduation commencement on the day that we originally scheduled it. But I do want to say that things change. They change quickly. We could run into limitations that necessarily wouldn't be our fault. The facility that commencement is scheduled in is like every other public and private facility. They're closed right now. There is no set date for that facility to open. We don't necessarily know when things may improve with regards to attendance here at the college. So we're faced with all those variables with regards to uncertainty. What we can say is that we believe there will be a commencement, and we hope it's everything that our graduating students would expect. It may be very different than what it's been in the past. We hope it's the same, but we can't say for certain that it will be.
So obviously for students who are living in campus housing, and for those students who are no longer living in campus housing, we really feel like there's an obligation by the college to give them some kind of credit, to give them some kind of refund to that. And we're still trying to work through all of that. You know, the college made a decision Thursday of last week that we needed to start moving to a distance learning environment. And so we've been working diligently to find out who needs to be here, who needs to come back, who needs to store their items, and then looking at the financial impact of all that. So what I can say is no later than the end of this week, probably earlier than that, students who are living in college housing, who have been living in college housing but are not coming back for the rest of the semester will get some sort of credit. If they are leaving completely and they're graduating, they will get some kind of refund applied. And we were working through that, and we'll get back to them with specific details in the near future. With regards to student activities fee, that is not something that would be refunded or credited back, because we still have a significant amount of students on campus. And not to mention that we are concerned about people's psyche during something like this, where they are kind of trapped in certain environments and limited and in isolation. You need to do social isolation during this time, but social isolation can be really tiring and taxing on individuals. So we plan on having events, we plan on having activities, and what we don't have will roll over to the next year, so that is money that students can be able to use in future years. I know there's questions out there, well, what about bigger events? What about Springfest? It's premature to have those conversations right now, but as of this exact moment, Erie County will not allow us to have people of gatherings of more than 50 people. We can't buck that. If that's what the county is saying, then obviously that's going to impact our ability to have an event like Springfest or anything else. So we're trying to be very cautious. We're trying to be prudent. We're trying not to cancel those things and just see how things evolve over the next several weeks, and then we'll make those decisions as we need to. But we are going to continue to have activities, and they're going to look maybe a little different. We might do some more things virtually. We might do some other things to connect people with each other. For people who are on campus, we might do some smaller events. Again, that we want to keep people safe, we want to keep them healthy, but we also think that people need to connect with people in some meaningful way.
So the theoretical courses, those courses that are more didactic, they're going to be taught in a remote manner, and we think that, that platform will be well received. The students will be prepared for it, and the faculty, I think, will be very creative and innovative in delivering it. The labs are another issue. The labs are extremely complicated. There will be some labs where the faculty members can provide theoretical information around the lab and provide data and exercises that would allow the student to simulate a particular lab. And that may be in physics or chemistry or biology or something of that nature. However, the labs that are associated with some of the graduate programs, such as physical therapy and physician assistant, athletic training, nursing, things of those areas, that's much more complicated, and that's really out of our hands. The external accrediting agencies who accredit those programs, so just as an example, the American Physical Therapy Association accredits physical therapy. The Commission on Physical Therapy Education has the authority to authorize the college to offer that program. That external agency dictates how the labs must be completed, and how students are evaluated to be in accordance with the skills of proficiency that are associated with that lab. It's basically a promise to the public. So those agencies, when they authorize a program, are promising the public that whomever graduates from that program will be proficient and skilled in that particular area of professional practice. So the external accrediting agencies have basically said that those labs that require hand-on skills, those labs that require face-to-face interaction, simulating, a particular maneuver with a patient, if you will, a subject, they have to be performed in a lab face-to-face environment according to our accreditation. So that forces us to look at the model where students who are in those labs, in programs such as those that I've mentioned, will most likely have to come back to campus and complete those labs that are associated with the theoretical components of those courses. We don't know when that will be. That certainly depends on the overall virus and the social response to it. But once we get a green light on being able to schedule those labs and bring students back so that they can complete the labs, we'll do that. But what we are doing to try to make this as efficient and manageable for the student is those programs are going to teach all the theoretical materials first, and even the theoretical materials in the lab element of the course. And the only things that will need to be then covered will be those hands-on skills, those clinical techniques that you'd be exposed to and practice and then deemed proficient in with regards to the lab. So it's not an easy resolution. It's a little more complicated. Some labs won't be affected at all. Other labs will be a little bit more complicated.
That's one of the biggest considerations we've made in all of this. We want to make sure that as we're continuing our operation and doing all the things we can to move things forward, that we're taking care of our community members, our faculty, our staff, our employees, including our students, to make sure that they still have a job and livelihood. You may have seen other places and other states where, if they're not working, they're out of luck. And that's not how Daemen operates. That's not the vision that President Olson has. That's not how Dr. Brogan and I work. And so we're doing everything we can to make sure that we're not only continuing operation, but they're making sure that people are able to be employed. And that includes if their kids are home because of they're infected or affected by the coronavirus, or because schools have shut down for the next month like they have, they're still going to be taken care of in the immediate future. For our student employees, we're trying to do the exact same thing. So what we're asking is that student employment is kind of coordinating a process where they're asking those employees to self-identify where they've been so we can give them a pre-screening. That's meant to give us a modicum of safety to know that somebody is not really carrying at the moment and they can be on campus. And then we've asked all the supervisors to find out what their needs are on campus. Some areas are going to need more. The RIC, as Dr. Brogan was mentioned, is going to be open regular hours, and being open regular hours means an awful lot of students to keep that operation moving. So we're going to work to prioritize that. Other areas that might be closed at the moment, we're going to look for those students who need work, who are still in town. We're going to see what we can do about trying to get them into other areas. It's incredibly challenging right now. It's a moving target, and I know everybody wants to know, what about me? How am I going to make this work? What I can say is that we are working through this quickly. We're trying to get student workers back on campus by the time we officially kick off classes again next week, and we'll be in touch with them as we continue to communicate and pre-screen and make sure that we've got everything that we need in place. We are aware, again, as we've mentioned, both Dr. Brogan and I have just mentioned, that this keeps changing every minute. About an hour ago, Governor Cuomo announced several closings. He announced that the restaurants, bars had to move specifically to takeout. The AWC, which is a gym, gyms have to close. Obviously, we can't go against what the governor says, so we are going to have to go ahead and close the AWC, and we know that affects a lot of student employees. We are going to do everything we can to find work for those students. What we need just at the moment is patience. As we get lots of questions coming in, everybody's asking one-off specific questions, and we're trying to respond as best we can. Again, every time we have a plan in place, we got to change it around. So we're working on that. We are going to do everything we can to make sure that those students have jobs and be creative about it. So, for instance, if the AWC has to close, we're working out ways through our wonderful athletics department. Can we do virtual health classes? Can we do virtual fitness classes? So we're looking at options for that. All of our buildings are currently open. Okay. It remains to be seen if we might need to adjust hours or things like that, but the buildings themselves are open and available. The labs, like in VPAC, are a little bit different. Dr. Brogan?
Yeah, what we're asking is for the faculty to work very, very closely with the students, and for the students to share any needs that they have, any desires that they have regarding equipment or facilities that may be on campus. So if a student asks to be able to access a piece of equipment, say in the VPAC in animation or something like that, then certainly the faculty member could grant that, and perhaps even provide some guidance if requested. We'd like that relationship to be available for the students. So there won't be any limits on that at all. Certainly we have to abide by the social distancing parameters and so on. So there can't be groups of students or a large number of students in a particular lab, because then we'd be outside of what's being expected from a societal perspective. So I'm hoping that a student would speak to a professor. The professor would encourage the student, to ask any questions that they may have. And if we can provide a resource, maybe a space, maybe a clinical room, examination room with the appropriate examining, equipment, I'd like to think that, we'll make that available and provide those resources.
And I think it's also important to note what the college is doing to clean our facilities, because that's a question we get regularly. And we are not treating this as business as usual, right? There's a health safety aspect of this also, and there's also just a peace of mind for people seeing it. So our facility staff has ramped up significantly what we're doing. You'll notice a couple of times a day that they have all of their workers, not just housekeeping, but maintenance and grounds, coming together and doing a blitz of common areas and doorknobs and using Clorox and all that stuff to kill anything in those key common areas. You'll notice campus safety staff walking around when they're doing rounds. They have gloves on their hands. Same thing, you'll see that from facilities as well. Offices are being cleaned and sterilized, and then we're putting tags on the door to know that they've been sealed. We have a system in place to know that when somebody needs to go back in there, campus safety is notified so facilities can hit it again. So we are trying to be really intentional in every way that we possibly can to keep things as clean and sanitary as we can to stop the spread of infection on this campus for people who are here. The president has also asked that we do our own self-isolation and social distancing, so people who can work from home are being asked to, people who can just kind of thin it out, so you have some people on staff on the campus this day and other people on that day. We're trying to do that. So we're trying to do all those best practices to ensure that we can continue to stay open. Again, we've heard from other colleges and universities, they try and navigate this. They all got to do their own thing. Some of them have closed their residence halls and just sent students home and said, look, you got 24 hours, get your stuff and leave. That's not how Daemen operates. That's not how we've ever operated, and that's not how we will operate. We have students who depend on us. So we have kept open, and in doing so, we also have opened ourselves up, and we want to do everything we can to take every precaution to keep people safe. Part of that is, okay, you're living on campus because you've got your own needs. That doesn't mean you can have visitors from outside the campus. We've done some pre-screening and have some reasonable level of comfort with the students who come back to campus to live in our buildings. But if somebody else just randomly comes on campus and they're visiting and they go through the stairwells and they're touching things, and that's how illness is spread. And we're trying to, as you might have heard, flatten the curve in terms of the number of people it spiked. So we have limited visitation for people, and that's out of an abundance of caution. In addition to that, we have said, listen, if you're a first-year student in Canada and you've had a car, instead of parking at Collegiate Village and then you have to take a shuttle and you're sitting in public transportation, bring it on campus. There's obviously not a parking issue at the moment, so we're going to go ahead and work with you on that. Our shuttle is still operating as of now, again, unless the governor makes a decree that we have to shut down public transportation, then we're going to continue doing that and operating, but this will help students be able to get their resources a little bit easier. If anybody's been in the dining hall today or the Wildcat Den, they would have noticed some very significant changes. In the dining hall, we've moved to all takeout dishes, and while that's not necessarily the sustainability piece that we would like to have, usually it's in the best interest. So one, we're cutting down on the people being in the dining hall. They can get their stuff to go and go somewhere else immediately. In addition to that, utensils. One of the things that Daemen has always done is we serve the students ourselves instead of leaving the forks and the utensils for them to serve. So we do that. That cuts down on the people wearing gloves. Even so, we're changing those out every hour and keeping those clean and washing them as well. In addition to that, we're just cutting down the dining hall. There's less people on campus. The dining hall is completely open. People can spread out and keep that social distance that we want to have in place and necessary. As this moves forward, we might have to look at, maybe the keeping both the Wildcat Den and the main dining hall doesn't make sense to keep them both open. Maybe we just have to switch to just having the dining hall open. Regardless, students will be fed. They will be able to use their meal plan. We just got to balance that out and make sure that we're not wasting resources either.